My name's Melanie. Very strangely, last year, 1st of January 2019, woke up with pains in my back and my leg. Really surprised and quite shocked. And then found myself a few days later having to crawl around, slide down the stairs. I was in excruciating pain, ended up in casualty, where I was then put on painkillers and told that I had bilateral sciatica. Since that time, not much has happened. I've had injections in my back to try to help, which didn't prove to do anything at all. And then on the 1st of August of last year, I had back surgery, which almost left me paralysed. I didn't have any sensation or feeling in my right leg, and luckily enough, I came to with that the next day. But I was left on a Zimmer frame and had to go into physio rehab for 3 weeks. Did need to stay longer, but that's what I got for that period of time. And it was only 2 months later that my mum was just on the bus, saw your sign outside the osteopath that said, she thought it said, "I can heal you," but it said, "Can I heal you?" She said, "I have to go there." She said it was a sign. So following my mother's wishes, I then came along to the practice and met yourself. And it's been a revelation since then. I mean, I came in thinking, will this work? I know you gave me the talk and told me that I'd need 20 sessions, and that you've done this and you've seen people come out the other end so much better and off medication. And one of the things that I deem to do is get off medication. Now, it started with 8-week sessions, been seen twice a week. And initially, I couldn't have anybody touch my leg. It was extremely painful. So when we started, I was in a lot of pain. Went home, I was in a lot of pain. Then as the weeks went on, it was painful but bearable. And it was becoming, it was almost like I felt a strength within me, which was really sort of shocking because I hadn't felt that for a long time. Then we had the health talk, which was, it was a lot of things that we knew, but you went into a deeper discussion about pain, health, how we treat our bodies, and it clicked, it resonated with me that I had to make lifestyle changes, which I knew already, but it gave me more of an insight as to what I needed to do. And then as we went on and we got down to single weeks, I felt incredible. I felt like I would leave here and to not have to balance on those sticks as much. And it's just been even better as I've gone on. So as we went down to the single weeks, it was fine because I was thinking, how am I going to deal with this if I don't have 2 weekly sessions? But because my body was strengthening and I felt a lot straighter, a lot taller, I didn't realise just how much it had actually done for me. And as we've come to a fortnightly session now, it's even better. I mean, I almost left here without my sticks, and I thought, wow, that's brilliant because the balance is there.
So if I can again just summarise, because it's really, really interesting case. So Melanie had terrible sciatica and back pain. She has had that for about a year. She's had back surgery, discectomy, and had what, 1 spinal injection or 2?
I've had 3 spinal injections.
So 3 spinal injections on multiple medication and some serious drugs. Multiple physiotherapy treatments. Can't drive. Off work, haven't been at work for 8 months or something like that. So, you know, would be fair to say you're stuck at home.
Yes.
Probably slightly depressed with things.
Yeah.
And yet, within only 9 weeks of coming here, we got Melanie, she had to walk with these sticks. You couldn't walk without the sticks, right? So within 9 weeks, considering she's had all this intervention from, you know, from medicine, within 9 weeks she was walking without sticks. She was back driving.
Yes.
And that was amazing.
That was amazing.
Your face when
independence,
you came in.
I know.
Gains independence. And actually now back to work.
Yes. Which is great.
And we did all that in 9 months. We did all that in 9 weeks, just treating Melanie.
Yeah.
And we did it with our hands.
Yes.
I mean, you know,
it's amazing.
People are sceptical, aren't they? Go, how can you get sciatica better with just your hands?
Yes.
But the thing to remember is that, you know, your body heals itself. And if Well, what controls everything that goes in your body?
Nerves.
Your nerves and your brain.
Yes.
And so if the messages from your brain aren't getting around the body, because there's maybe a misalignment in your spine or a disc pushing on the nerves, then things aren't going to work well.
Yes.
And if we can get the interference off that nervous system, then your body starts to heal itself.
Yeah, it really
and if we get the blood supply working better to the body, it will heal itself. So the body wants to heal itself. It doesn't need all these drugs.
No.
Because the back operation, doesn't solve much. It tends to just mask the situation or kick the problem into the long grass. Because the reason why did you have back operation in the first place?
Yeah.
The injections, again, don't solve anything because the injections are just painkillers. They just mask the problem. And then multiple medications, tramadol and all the other types of drugs you're on.
Yes.
Again, they don't get your spine or body working better.
No.
All they do is just mask the problem.
They do.
So
create problems.
Yeah. And so not only did we work on your body to get you better, but again, we encouraged you, didn't we? What's the difference in the psychology of treatment with the doctors and the psychology of coming in here?
Oh my goodness, it's such a big difference. Going to the doctors, you're given tablets or more tablets when you're trying to get off of them. Coming here.
And they tell you not to do things.
Yes.
Don't do this, don't do that. Your body's not strong enough. You can't do this.
It's almost like it feeds into the depression that you already have. So you feel less independent, more reliant on medication, and feeling that you're a bit worthless as well, really, that you can't do anything more. This is it. You're on the strongest painkillers, and if you go on to the next thing, there's not much hope for you.
Yeah.
Now, coming here, I found that even just speaking to you about little things that I was going through, feeling depressed, and it's almost like what the best thing is, and it's feeding that mind as well as getting that the body moving and strengthened again. And I needed that, and it's almost like I urged it every week that I had to have it, and it gave me hope.
Yeah.
And at the end of it, that hope has really come to fruition, because I can't believe after so long that I'm here walking and not afraid to be out there without the sticks. I feel so much stronger. It's unbelievable. And I never imagined that coming here doing a 15-minute session, I thought, what can you achieve in 15 minutes? A lot. A lot is achieved. I don't think you need any more than 15 minutes because you get so much within that time, and the results are there. You can see it.
Good, lovely. And again, what's interesting, when we spoke to Melanie when she was coming in, it's almost though the doctors had brought you down and told you can't do this, you can't do that, avoid doing this, avoid doing that, which made things worse, right?
Yes, it
did. And then you came in here and I said to you, well, why can't you do that? There's no reason why you can't do that. Your body is strong. You can do these things. And so we actually got you doing things, and all of a sudden you made this miraculous recovery.
Yes.
So just getting you doing things, getting your body working better.
Yeah.
So now look, there are people out there watching this, right? Who believe osteopathy doesn't work. They're very skeptical of it. One of my patients said to me, well, if osteopathy is that good, why isn't everyone doing it? That unfortunately it's a well-kept secret.
It is.
I mean, what would you say to people who are considering osteopathy? They're on the painkillers, they've been told nothing can be done, they've been told, it's your age or you just got to live with it.
Yes.
I mean, you've made a miraculous recovery. What would you say to these people?
I would say go out and do, not even to explore it, put your mind to it, get out there and see an osteopath. It isn't well spoke about, but what you get out of it is amazing. And get off the medication. It will do you no good at all. Yes, it solves the problem in that short period of time that you need it, but seeing an osteopath and getting that treatment, strengthening your body, is what's going to make it happen for you. It's what's going to make your life change. I would recommend it.
Absolutely. And again, just picking up what you said there, it's about getting your body working properly, because why did you get back pain in the first place? It's because things weren't working properly, and then you ended up getting back pain.
That's right.
You don't just get tooth decay for no reason.
No.
Right, there's a process. And,
Yeah.
and so what we do here is we get your body functioning better again so that you can heal yourself. All right, so
Yeah.
good. Look, it's been amazing.
Yes.
Thank you for
Thank
sticking
you.
with the programme.
Yes.
You've made amazing results, and you know, thank you for letting everyone out there know that there is another way.
There is another way, and it's brilliant, and you can change your life.